Rhonda Toney.
Good evening, fellow Toastmasters and guests. Tonight we're going to talk about an issue that is relevant to us all, and that's the prescription pricing problem in the United States. I have a unique perspective on this topic because I was a foreign exchange student in the Netherlands back in 1985. Since returning to the United States, I have been faced with what you could call reverse cultural shock, especially around the topic of healthcare and more notably, prescription pricing. When I returned from Holland in 1985, I immediately became a pharmacy student, and I've been interested in this topic of prescription pricing in the US ever since. In addition, since being a foreign exchange student, I've been in close contact with my host family from Holland and have engaged in multiple and long conversations on economics with my host father, Hans. What annoys me the most is the obvious difference between what we pay for our drugs versus what other countries similar socioeconomically pay for their drugs, such as Holland or Germany. American citizens consume a similar amount of drugs, and we also consume a large amount of generic drugs, which should equate to lower prescription prices. However, countries such as the Netherlands pay nearly 1/3 of the price that we pay for our medications. So let's compare and contrast the situation for a US citizen versus a citizen from Holland. And I'm going to talk about 3 topics related to the prescription pricing issue. The first is the drug pricing process. The second is medical or drug research. And the third is direct to consumer advertising of our medications. So point number 1, prescription pricing process. Dutch citizens are afforded a transparent process that is based on the demonstrated medicinal benefit of the drug. Prices are negotiated between a single buyer, which is not the government, that represents all health insurance on behalf of the citizens of that country with the manufacturer. In the United States, we have a completely non-transparent process, and our insurance system only further muddies what medications cost. Point number 2, research and development. In Holland, research and development is rewarded when a manufacturer is able to prove that a drug has a demonstrated additional medicinal benefit as compared to other drugs in the same class. In the United States, patients and taxpayers fund nearly half of all global medical research. However, research and development alone do not account for the high prices that we pay in the United States. And finally, point number 3, direct to consumer advertising of our drugs. When the Dutch turn on their TVs, computers, or open up a magazine, they are not, and I said not, consistently bombarded with advertising about their medications. In the United States, when we turn on our TV programs, open up a magazine, or open up the internet, we are consistently bombarded with advertisement about medications. Who hasn't seen the commercial for the little blue pills, Viagra? Instead, in Holland, providers are given relevant drug information on new drugs, which allows the provider and the patient to come to educated decisions about new drug therapy. When I first became a pharmacist back in 1992, my eyes were open to the significant hardships that regular American citizens like you and I face when having to pay for our medications. I'm reminded of my patient, Jean Evans, who came into my pharmacy on a Friday night. And Jean was experiencing significant labored breathing and faced with a price tag for his medications that he could not afford. Jean and I became lifelong friends after I made a choice to pay for his medication because I didn't want him to have to choose between breathing and not breathing. More Americans report that they didn't fill a prescription or skip doses because of the cost of their medications compared to other similar countries. Because drugs are made via a specific recipe and are not equipped with special technology like German automobiles, which may account for the high price tag, the cost of our medication should not exceed the cost of the medication that other similar countries are paying. More importantly, American citizens should not have to make a choice between paying for their medications or breathing like Jean did. Thank you.
Thank you, Freeman. Rhonda, I thought you did a great job. You clearly enunciated every word. Your speech was well paced. You did a great comparison of the United States to a more civilized country, and nice use of facts. For your next speech, you may want to work on arranging your workstation so that we can see more of your body. I could tell that you were using your hands a lot, but I couldn't actually see most of your gestures. And one thing that Toastmasters has taught us is how using our body to emphasize our words can help the audience follow the speech and be engaged. To challenge yourself, you might want to find a way to inject a little more humor into your next speech. I laughed when you talked about Viagra, but you know, it helps, again, humor helps the audience connect to serious topics. That's all for me. Thanks, Freeman.